Hello everyone, my name is Raiza. Welcome to this new season of the podcast Health Around the World. Today we're going to talk to Michaela. She has just graduated as a doctor in Germany and she's going to talk to us about healthcare system in Germany, how was her medical school experience over there. Also, she's going to talk to us about all her volunteer experiences, and it's super interesting if you think about going abroad to volunteer as a medical student or as a doctor. It's going to be really interesting for you. So let's go.
Hello, my name is Michaela. I'm 25 years old. I'm from Germany, and currently I'm in my last month, actually, of med school.
Congratulations.
Thank you. I live and study in Freiburg. That's in the South Germany, in the middle of the Black Forest. It's kind of cute.
Yeah, you like it.
Oh yeah, I do. Yeah.
How is it to enter university? I was reading and it's extremely competitive. I saw it.
They've changed the system now a little bit. Well, actually, when I started to study, it was mostly your high school grade that determine if you get a slot or not. So back when I started studying, it was 20%. The best 20% would get in with their marks, and 20% would get in simply by the so-called waiting quota. So they had to wait up to 7 years, and after they've waited long enough, they were also allowed to enter university. And then the other 60%, like every university had their own ways of deciding if they would grant you a spot or not. And I started studying in Essen, and so they would invite you to an interview where you would talk to doctors who were asking you, why do you want to study medicine, and wanted to know basically everything about you. And I thought, well, I'm going to try that. And yeah, they accepted me, luckily.
Oh, that sounds actually hard because how old were you like when you had this interview?
I was 18. Yes, I was 18, and I still remember this interview because I prepared very well. I think I was working. I did 1 year off after I graduated from high school, and I was like 9 months working in a hospital, and 3 months being abroad working also in the health system. So I was so prepared to tell them everything about it, and they didn't want to hear anything. They were just like asking really specific questions, like, do you know the difference between active and passive immunization in vaccines? And I was like,
Wow.
sorry, no. So a lot of time I was just like telling them I don't know the answers, but it still somehow did work.
It worked for you. Oh, oh, that's and I didn't know like about this interview thing. I imagine you get super nervous to talk to two doctors and we're super young, and a lot of times we are not even so sure why do I want this.
Yeah, I was really nervous. As soon as I got the invitation, I couldn't sleep anymore because I was actually so scared. And my uncle is a coach, so my mom kind of sent me to him, and we did some exercises together, how to prepare for that very big moment. And I must say it did help me a lot to, yeah, keep my nerves and yeah.
And you were always sure you wanted to be a doctor?
Um, no, actually, when I was a child, I tried to convince other children of not becoming doctors because then you have to see blood and give shots to people, and it's very brutal. So I was not at all convinced of this whole concept. It, it luckily kind of changed during puberty. My mom's a nurse, and she'd always tell about her life in hospital, and she loved her work very much. So I became more and more interested.
And after all this preparation for entering med school. How was it? How was medical school itself in Germany?
Med school in Germany is like divided in three parts basically. And the first 2 years are just basically the basics. So you have all the science stuff, you have anatomy, biochemistry, physiology. So the first 2 years, they really try to. They're really testing you, and you will have to study a lot to learn a lot. You have lots of exams, written ones, oral ones, and the first 2 years were really hard. And then you have a state exam, like you have a written exam and an oral exam. And if you pass this, you enter the so-called clinical phase. And then the next 3 years, it's just basically you have every medical specialty as a subject or as a class. So you go through pediatrics, pathology, internal medicine, surgery, and so on. And then it's followed by the so-called practical year, which I'm doing now, where you work 4 months in internal medicine, 4 months in surgery, and 4 months in a specialization you choose.
Mm-hmm. And what did you choose?
I did choose psychiatry.
And how is it?
Oh, it's really nice. It's I didn't expect me actually to end up there, because it's nothing you imagine when you're like in your first semester and thinking of becoming a doctor. But yeah, I really do like the work, and I think it's super important because so many people actually suffer from psychiatric diseases during their lifetime. And yeah, I think the mental health is a topic that often is more or less forgotten, but has so much impact on us.
So let's talk about your international volunteering experience. Can you tell me what have you been doing? I know you have been working with the refugees a lot. So how did it start?
So it basically started in 2018. There I went to Lesbos for the first time, and I was only there for like 3 weeks, and I did volunteer in a community center. So didn't have anything to do with medicine. It was just like a center where people could come to have a good time. And but that's when I first really saw how miserable the conditions in European refugee camps are. And I made friends with some people, and so this time really shaped me. And for me, it was pretty sure that I wanted to come back as quickly as possible. So I decided to just like pause for one semester my studies. And then I went to Samos, another island with also another refugee camp, where I was part of an NGO that was also working with refugees, and that's also where we met. So
And talking about this experience in Salma's working, tell us a little bit what you were doing, what was your role as a medical student, because you went there as a student. What were your responsibilities and what were you doing?
the rhythm of the clinic was basically that we would have the triage in the morning, and then in the afternoon the doctor's consultations. So that would mean that we'd open at 7, and then everybody until 11 could just come in, and they were seen by us, by the medical students and by the nurses, and sometimes also by the doctors. And we were like doing the so-called triage with them. That means that we were asking for their symptoms, and if we would think, okay, that's just okay, this person has just like a little cold or something that is not very dangerous, we would like give them medicine straight away. Of course, like I, since I was still a student, would always talk or like talk about my decisions and impressions with the doctor, so I was not unsupervised. um, and then I would, yes, but when we would think, okay, this is like a harder case and a doctor would really see this person, we would give them an appointment for the afternoon where they would have like a longer talk with a doctor about their health issues.
And how did this experience affect you?
Well, it was kind of shocking for me to see how many people with traumatic experiences were there, especially the people from Congo and Cameroon. They all came and were all victims of, a lot of them were victims of trauma or victims of sexual violence, and they were really not doing well, and all they wanted was to see a psychiatrist and someone that they could talk about with, like talk with about their experiences, but there was simply no help we could offer them in that way. And yeah, that actually affected me quite a lot. And so I think that's also one of the reasons why I'm now working in the psychiatry, because I thought, okay, it shouldn't be that way.
So we know that these people in the island of Samos, where we were both volunteering in this free medical clinic, we know that the clinic itself doesn't have all the resources, but at the same time, it is very important for the community. Why would you say that this clinic is so important for these people?
I think an important thing that happened in the clinic is that I mean, the people are treated like shit. The government and the European Union, they don't care about them. Then they're not being treated as human beings. And I think simply the fact that they could come to us and we would take them seriously, we would listen to them, and yeah, see them as people who are like exactly the same humans as we are, and that we are all basically the same and have the same dignity, also did make an impact, sometimes more than, I don't know, the ibuprofen that I could give them.
And for a medical student that is interested in volunteer work in humanitarian medicine, if they want to go for a volunteer experience abroad, what would you tell them? And also, how to find this type of opportunities? Because this is a very important question, also.
Well, I would tell them, go, do it. Don't hesitate. I think what sometimes is difficult when I'm looking for stuff like this, that you don't even know where to start. Because when you Google volunteer, you find like lots and lots of pages on Google that all tell you, hey, here you can pay 5,000 euro and you're gonna be part of something, but it's basically just scam. So I would recommend to yeah, maybe at first look at where you want to go. I mean, if there are like crisis somewhere, it's very, the chances that there are some NGOs already are pretty high. And then look more specific for places where you want to go. And also, a lot of the tiny grassroots NGOs very often don't have the most special websites where you get all the information immediately, for example. And I mean, this can also make it difficult to really know, is this an NGO that actually is looking for someone, or I don't know. And there I would recommend just write them, because if they're like tiny grassroots organizations, they'll very often just don't have the capacity to have like a fancy platform, because they're so busy to handle everything that's going on on the ground. I would tell everybody, just text, just write everybody, even though the social media platform does not really convince you.
I think it's also important to talk about how hard it is for people that are interested in working with humanitarian medicine and to work with refugees, migrants. The situation in general, it's not easy. We hear a lot of complicated stories, and most of the times the help we can give is limited, right? So prepare yourself, because it can also be hard on the volunteers.
I feel like what also made it hard was, usually when you work in a professional context, you work, it's kind of hard, but you go home and you keep on living your life. But there it was kind of a crazy mixture between, you're also on this island, you have friends in the refugee community. So it's not like you go home and you can say, okay, this topic's over, but you're friends with the people who have to suffer all this. And so I feel like it's very hard to keep a distance when you're in this kind of setting.
And also, I don't know if you felt like this when I actually left the island. It's like a huge feeling of guilty because you are leaving, but everyone else is staying, not because they want to, because they are stuck.
Yeah.
So,
I think that's also why a lot of volunteers keep coming back.
mm-hmm.
And like we also kind of keep coming back or are still involved with this whole topic somehow. And like I think for me, like I'm a European, and it did also affect me. My government, the government that I voted for, is also kind of supporting this system. At least it's not shutting the system down. So as a European who was raised with the awareness that we are the union who have all the human rights that are so important and whatsoever, it kind of really makes me mad because no, European Union does not care about human rights, apparently.
And how was also this experience of working with doctors from different countries? Did you feel like it was really different from what you were used to in Germany, or how was this international team communication? And
I really liked it. I felt like that in contrast to, for example, a setting here where I am in a hospital and I'm a student and I'm, of course, way below the doctors or something. I felt like, yeah, everybody was treating you very kindly and were eager to explain things to you. And yeah, I feel like despite all the different nationalities, I don't know, I didn't feel like I was realizing it so much during work if someone was from the States or France or Switzerland, because everybody had the same goal and the same virtues kind of. So the working together as a team really worked well, I think.
okay, your experience with patients then, because of course they come from a different culture. Was it something that somehow made it harder talking to the patients, or the cultural difference, did it affect it somehow, your relation with the patients?
Well, I feel like with every new nationality, you had, with every patient from a certain nationality, you had to find a certain way of communication. So, for example, the people or the women from the African country were usually really open about all their sorrows and problems. So I realized that I could also talk very openly to them and ask proper, like direct questions immediately, and they seem to be okay with it. Whereas people, for example, from Arabic countries would be like initially rather timid or shy, and I realized, okay, I'm gonna make my way through it slowly without being too direct in order to not make them scared or be like, okay, what, I don't know this, I'm out here. So yes, I think a little cultural awareness is definitely needed in this kind of setting.
And was there a special case or a special patient that really marked you?
Oh, that's a very interesting question. um I think it was maybe one of my first patients. Was, I mean, I came there in the beginning of March. Yes, of March. So it was still really cold when I arrived, and I definitely didn't have appropriate clothes with me, so it was still cold in the night and everything. And my first patient that I saw was a man, like, I don't know, 1 meter 90 tall, like pretty, like huge shoulders, and he would enter the room and close the door and then directly sat in front of the door, so there was also no way out. And in the first moment I was still like this unexperienced med student, and I was like, oh, hee hee, I hope I can help him. but this I kind of felt insecure with this whole setting still, and so I really, yeah, and the first thing that the guy said was, it's, I can't handle it anymore, it's too cold, it's too cold outside, and I just can't do it anymore. And then he started to cry, and I was like, wow, I was so wrong with my whole yeah, how I thought about the situation. And I just would tell him, wow, I'm so sorry, I feel I'm cold too, and I can't imagine how it must be for you sleeping outside. And then I could just tell him how sorry I was, and how much the situation sucked, and that was it. He didn't wanted anything more than just have this room to cry and be sad and desperate, and then it was okay, and he left. So that was really, yeah, I think the first time that I really faced the cruel reality that was refugees had to survive in, basically.
And moving to our last topic, healthcare in Germany. So, can you explain a little bit how it works, healthcare in Germany?
We have an obligatory health insurance for everybody. So we have public healthcare for everyone, and it's not like it's not national healthcare in sense that it's funded by our taxes, but it's more like when you have a job, a part of your income is being taken, and you pay the money for the health insurance, and this is dependent from the height of your income, how much you're going to pay. And but also if you're like unemployed or something, you still are you have this health insurance. So it's kind of the solidarity principle that Germany wants everybody to have or to be in a health insurance. And so if you earn a certain amount of money, you can, for example, switch from the public healthcare system to the private one. And there yeah, you get different, for example, you get your doctor appointments faster, you get sometimes more tests done, which can be good or sometimes very unnecessary, because the clinics or the doctors, they get more money when you're a private patient. So for them, it's very valuable to run a lot of tests on you when you have private health insurance. And yeah, I personally am not a very big fan of this whole private health insurance, because I think it's okay that you maybe have like a single room in the hospital when you have private health insurance, but I don't think it should be that way, that you get like important doctor's appointments quicker, or that you get more or a different or maybe better kind of medicine just you pay in the private sector.
And do you think the public healthcare works good enough for everyone?
Well, I think in contrast to many other countries, it does. But of course, there's still a lot of room for improvement, as always. And we have a lot of bureaucracy. A lot of other countries do not have enough nurses, for example. We don't have enough doctors. So that's definitely something where Germany should step up a little bit as well.
And do you know if refugees, for example, also have free access to the public health system?
Yes, they do. So if you're here and you have like registered, you have the right to access medical health care technically. But then, for example, when you, for example, are illegal in Germany because your asylum application, for example, has been denied, you cannot get access anymore. And if you go to the hospital and they have to report you, and then deportation police, I don't know how to call them, is going
Mm-hmm.
straight to the hospital to take the people. So there are also a lot of NGOs in Germany that offer medical care for people without papers, for example.
Yeah, and it's important to say that this fear of deportation, if undocumented migrants look for healthcare, it's a really big problem. And many countries have actually increased these barriers over the last years. For example, the United States, European countries, Canada, they have new policies that actually limit access to health services to these people. And these policies, they range from denying all types of access to just providing limited access to emergency or preventive care. That's also why there are so many organizations now that provide free healthcare to refugees, migrants, and undocumented migrants. And it's always important to remember that a hospital is not the place to enforce immigration policies. And finally, just tell me a little bit about your future plans. You mentioned that you want to go to psychiatry. How does it work to enter residency in Germany?
Well, actually, I'm gonna have a talk with the head doctor of psychiatry tomorrow in the clinic I'm currently interning. So I really do hope that tomorrow's gonna go well. And in general, it's basically that you graduate, you make your final exams, and then you can apply to wherever you want to work. There's no extra test or anything. When you want to start in surgery, you go to surgery, and if you realize after 3 months, oh, I want to be ophthalmologist, you apply there, and so it's very free.
So good luck
Yeah, thank
tomorrow
you.
your talk.
Well, it has been really fun to be on this podcast with you. So I'm currently very happy, and
Yeah,
I hope that I said some interesting things.
for sure. Thank you.
Yeah, thank you, and goodbye.